You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Today is Friday, April 26th, and welcome to another episode of Last Week in Health IT. And as with every episode, we start off this one saying that the intended audience is everybody. So I hope you guys have been doing well. And this week, there's actually not a lot of news that's going on right now. So I guess we'll just get right into it, but just be aware this might be a shorter episode than normal. So Marin General now spends $15,000 instead of $400,000 to protect its printers from cyber attacks. So what do I mean by this? So printers are actually a vulnerability, and they have a lot of issues with it where it allows holes for people to get through and then create cyber attacks, right? So Marin General, they went with this company that they've already had a relationship with, and it's called Symphion. And what they do is they basically do what's called cyber hardening of the printers. And what the cyber hardening means is that it removes vulnerabilities, it removes gaps and holes in the security so that it increases the security of the system, making it less vulnerable to cyber attacks. And basically, when they were doing an assessment of their 1,000 printers with over 60 different models, they calculated that if they did what Symphion does by themselves through all 1,000 printers, it would actually cost them about $400,000 per year. And by signing with Symphion, they actually were able to reduce that cost down to $15,000. So it's a really cool win for them to be able to save that much money to increase the security on their printers to prevent cyber attacks from happening. And as you know, with the healthcare landscape, cyber attacks are very, very crucial to prevent. All right, so the next news item is Croatia. They are joining the e-prescription exchange pioneers. So basically, they are being the 5th country that's ready for cross-border exchange of e-prescriptions. And just to back up a little bit on that, right now with Finland, Estonia, Luxembourg, and Czechia, they are all interchanging the information of the medications prescribed for the patients. This is actually going cross-border, which is really, really great because it's allowing people who go between the countries to have a history of all the prescriptions that they've been taking. And not only that, but it's sharing e-prescriptions and also their patient summaries and, having all this information being exchanged between countries so that people who travel between the countries, their doctors will have the most complete information they can to provide the best care for these patients. So the next news item is Mayo Clinic and Arizona State University. They picked 6 startups for Health IT Accelerator. So just to back up a little bit, the accelerator program is so that they can help with developing business plans for startups and basically optimize the products or the services or, licensing the intellectual property and even sponsoring the research or the studies that are needed to get these startups going. So they recently announced that they picked the 6 startups for Healthcare IT's accelerator. So like I said, there's 6. So there's one that is in San Francisco. It's called Giant, and they're basically using artificial intelligence, and it combines with messaging. And they also have medical experts on their team. So basically, they're trying to create a startup where it's going to improve the diagnosis and treatment of conditions or disease states that are not considered urgent, but more of a chronic condition. There's also another company that they have chosen, which is Bio Interactive Technologies. And there's a bunch of wearable devices that this company would actually work with. And it's for the hand and the wrist therapy for basically rehab and sports medicine. And then there's another company called Hexoskin, and they actually produce something really cool. It's a wearable shirt, and it has sensors in that shirt, and it uses artificial intelligence, machine learning to kind of pull data from how the biometric data is and pull analytics from it. So it connects it to this patient monitoring platform so that they can monitor different aspects of the patient by wearing this t-shirt. Securison is another one where they're sponsoring. It's a medical device that provides airway stability for ventilated patients. And another company that they are sponsoring or they've chosen for this accelerator is the developer of a sexual health application called Safe. And this actually provides low-cost testing. And then there's also information sharing and education for the consumer or for the patient in terms of practicing safe practices. And finally, they have something called Life 365. And they chose this because this company is very focused on the consumer at home. And it has an operating system that supports wearable technology and even software, and it integrates with hundreds of different medical devices. So by choosing these 6 companies, the accelerator will help advance with artificial intelligence, wearables, and engaging consumers both at home and, in the workplace or anywhere else. So the next news item is German pharma group, Bayer. I'm sure everyone knows what Bayer is. They, the Bayer aspirin, come on. So everyone knows that. So they are trying to draw digital health startup corporations through their G4A partnerships. And if you don't know what the G4A partnership is, according to their website, G4A is a global team of intern and entrepreneurs with presence in 35 countries enabling positive disruption in the digital health and care industry. And they say that they do this through new business opportunities and partnerships anchored in behavioral science. So why is this a news item? So before the G4A, or it's actually called the Grants for Apps program, they actually had 3 different types of funding programs. One is the Accelerator, another one's called Dealmaker, and another one's called Generator. So this is in the news today is because Bayer actually consolidated all 3 of them into just one type of funding. So when anyone tries to apply for a grant for the G4A grant, they only have one opportunity now. And in addition to that, they also need to submit a letter of intent. So what do I think about this? I think it's actually okay, because before, when you have it segmented across like that, then it's kind of hard for people who try to apply for the grants to figure out where they want to apply to, right? So by consolidating it, they're just like, okay, digital health, G4A, I'm going to apply to that. And so it's a little bit easier on that side. There may not be as many perceived opportunities because it's all consolidated now, but at least it makes the application process easier by not having to choose between which funding to actually apply for. All right, so the next headline is Boston Children's and More Health partner to advance physician collaboration. So the company More Health, they are a company they're kind of focused on cloud-based physician collaboration. It's a platform. It basically connects the patients attending doctors with physician specialists to kind of jointly work together and collaborate with diagnoses, and then, formulate a optimal treatment plan for the patient. So Boston Children's Hospital have partnered with More Health, and it's basically giving patients in China access to the physicians and services of the hospital through Moore's physician collaboration platform. So this is a big win for pediatrics, especially at, Boston Children's, because now more providers are able to have access so that they can provide that collaborative care to the patient. Having multiple minds, it's kind of like getting more than second opinions, and the collaborative nature of working together to diagnose someone can potentially increase the accuracy of it, and then also kind of consider all the different options, all the different treatment plans that can be given to that patient. So this is a good opportunity for better patient care in general, and also more collaborative practices between physicians and specialists. All right, so the next news item is Vanderbilt's AI-powered EHR voice assistant saves time for caregivers. So this one is actually pretty cool. So Vanderbilt University Medical Center, it's a very, very large academic medical center in the Southeast. It's located in Nashville, Tennessee, and they serve both primary and specialty healthcare needs for a lot of patients in the Mid-South and, throughout Tennessee. So this tool that they have, it's the Vanderbilt AI-powered EHR voice assistant. So it's called Viva, V-E-V-A, for Vanderbilt EHR voice assistant. It actually uses artificial intelligence, and it actually also uses natural language processing. So they created this after, the popularization of Siri and other voice assistants out there. What's really cool about this is that, let's say, for example, a nurse asks the weight of the patient, right? The voice assistant is smart enough to know to not only give the weight that the nurse asked, but also to infer that, maybe this nurse needs to know previous weights and then needs to trend the weight. So the voice assistant will tell her the previous weights, and then it will also show on-screen graphics to probably try to trend and chart the weights so that they can see on screen. So that's really cool, and it's one of the homegrown software applications that's not very common nowadays, but Vanderbilt has found quite a good amount of success with it, with the caregivers. So basically, when they looked at it, they looked at the time savings that happened. It basically reduced a lot of the clicks per question. So it translates to about, what they found was a 15% improvement in task time savings. And when you're thinking about, how many patients are seen a day and how many hours are spent, just navigating the EHR through clicking here and there to answer questions, 15% can be a lot. And that 15% of time can be used to see more patients, right? So this type of AI-powered voice assistant shows a lot of promise for, probably implementing it at different facilities as well. All right, so the last news headline that I have is connected devices and legacy systems leave hospitals wide open to cyber attacks. So as you know, healthcare systems are being attacked a lot through cybersecurity threats. So Vectra, which is a company that focuses in on networks and security, they released a study that monitored 6 months of traffic that looked into which are the most prevalent methods that attackers use to gain control and access to PHI. And what they found was a lot of it is in connected devices that don't have proper access control, and also legacy systems that also don't have the ability to be protected by the newer security measures. And a lot of the legacy systems, it's also very hard to patch because, a lot of these are hospitals, health systems, so they are operating on 24/7. So it's hard to actually create a downtime that's long enough for, having such a major patching of it to meet the standards of today's cybersecurity protections. So this is kind of surprising to me because I was always thinking, we always hear about the ransomware attacks that's been happening in healthcare systems. So what they actually found was that ransomware attacks in recent years were not actually as prevalent versus, internet connected devices and legacy systems. So I guess that also kind of makes sense, but it is a little bit surprising because of how the media has portrayed all these different attacks. And, I think it's also with time, people are more aware of the ransomwares that now it's not as prevalent as before. So before we go, if you'd like to check out more news on healthcare IT, you can check out great curated articles at healthcareitnews.com. It's actually where I go for daily healthcare IT news to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you guys can subscribe and rate us on iTunes, Stitcher, Google Play, Spotify, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or our Instagram at PharmacyInformatics, or by emailing me at tony@pharmacyitme.com. And I wanted to plug a great networking opportunity. I've already talked about this, but I'll say it again. It's Pharmacist Connect. If you guys are familiar with Slack Workspace, think of it as a vetted one through Slack Workspaces. So you actually have to have a pharmacist license that gets vetted by the person in charge of the group so that everyone that's in the group is a vetted person. And it's a great networking opportunity, and I've actually met a lot of great colleagues on it. There's also different channels for different focuses like, community or hospital or informatics. So it's great to network with other people through there too. And you guys can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.